Good evening, everybody. Let us talk up today about if there is a very important question, which is if the Excimer laser or intra-LASIK or smile or femtosecond laser is suitable for every error of refraction or not. In fact, it is not. Why? Because some people has high myopia, like -10 and over, or high hyperopia, like +7, +8, and they cannot use this technology because in this case they will be a very harm can added to their corneas, and they will be having more problems and more complications which will affect their vision at the end eventually. So we have to have another solution. The solution is called the Phakic IOL. So this Phakic IOL is an implantable lens. We will talk today about one type which can be implanted in the anterior chamber through 3.2 millimeter opening in the eye, self-sealed without any sutures, and it is called iris claw or Artiflex. Iris claw or lobster claw, because it has two claws, and we are enclavate the iris tissue, which is the colored part of the eye, in between the two claws over the pupil, and will centralize the pupil and will centralize over the pupil. So I will not talk too much, so I think we can see the surgery right now easily. So be our guest. Now you can see now the spatula with the Artiflex lens, and it is now in the anterior chamber through 3.2 millimeter, and this is the enclavation of the left side using enclavation needle and left forceps. You can see now how the needle is enclavating the iris tissue in between the claw of the lens, and this is the right enclavation, and you can see how much is centralized the lens.